Marijuana use is on the rise as laws change worldwide, transforming the way society views this once controversial plant. In recent years, we've seen a dramatic shift in public opinion and policy, with more countries and states legalizing marijuana for various uses. More people are turning to it for both medical and recreational reasons, seeking new ways to manage their health or simply unwind after a long day. Dispensaries are now common in many cities, and the stigma around marijuana is slowly fading. Some seek relief from chronic pain, anxiety, or insomnia, hoping that cannabis can offer what traditional medicine sometimes cannot. Others use it to relax, enhance creativity, or connect with friends in social settings, making it a part of their lifestyle. The conversation has shifted from criminalization and punishment to exploring its therapeutic potential and understanding its risks. But with increased use comes confusion, stories of benefits mixed with warnings about harm, and it can be hard to know what to believe. It's vital to separate anecdote from scientific fact, especially as more people experiment with marijuana for the first time. Cannabinoids in marijuana interact with our endocannabinoid system, a complex network in the body that helps regulate mood, pain, appetite, and memory. This interaction is why marijuana can feel calming or euphoric for some, but also why its effects can be unpredictable or even uncomfortable for others. As use grows, clear, fact-based information is more important than ever to help people make informed choices about their health. We need to look past politics and focus on health, safety, and the real science behind marijuana. What really happens to your body and brain when you use marijuana? The answers are more complex than you might think. Let's examine the evidence together to understand marijuana's true impact, beyond the headlines and the hype. When you smoke marijuana, THC, the main psychoactive compound, enters your bloodstream almost immediately, carried by the smoke you inhale. This rapid absorption is why the effects can be felt within minutes, making smoking one of the fastest ways to experience marijuana's impact. Once in your system, THC travels to the brain, where it binds to specialized cannabinoid receptors in the endocannabinoid system. These receptors are found throughout the brain and body, and they play a crucial role in regulating mood, memory, and other important functions. By attaching to these receptors, THC disrupts normal brain communication, causing the familiar high. This high can include feelings of euphoria, relaxation, and altered sensory perception. It also affects memory, pleasure, thinking, and time perception by triggering the release of dopamine, a chemical linked to pleasure and reward. This is why users often feel happy, giggly, or deeply thoughtful. While marijuana can make users feel euphoric, it also impairs memory and learning, making it harder to focus or remember new information. Some people may find it difficult to concentrate or recall details. THC alters sensory perception and coordination, which can slow reaction times and make activities like driving or operating machinery especially dangerous. Today's marijuana is much more potent than in the past, with higher THC levels that increase the risk of negative reactions such as anxiety, paranoia, or panic attacks, especially in new or sensitive users. In some cases, consuming high doses can even trigger acute psychosis, leading to confusion, hallucinations, or severe distress in certain individuals. Understanding how THC works in the brain is key to understanding marijuana's wide-ranging effects, both positive and negative, and why people respond so differently to it. Potency, method of use, and individual biology all play a role in shaping each person's unique experience with marijuana. The effects of marijuana are almost immediate, often felt within minutes of inhaling or consuming the drug. These effects can be both physical and mental, and they tend to peak quickly. The high usually lasts a few hours, but some after effects can linger, especially if a large amount is used or if it's consumed in edible form. Marijuana raises heart rate, sometimes by 20 to 50 beats per minute, which can be risky for those with heart conditions or high blood pressure. Marijuana smoke irritates the lungs, causing coughing, wheezing, and short-term breathing issues, similar to the effects of tobacco smoke. For people with asthma or other respiratory problems, it can trigger attacks or make symptoms worse. Mentally, THC, the main psychoactive compound, alters senses, mood, and short-term memory, making it harder to think clearly or remember recent events. Some people feel relaxed or even euphoric, while others may become anxious, nervous, or paranoid, especially in unfamiliar settings. Judgment, attention, and learning are impaired, making it difficult to focus or complete complex tasks that require concentration. Physical coordination drops, increasing the risk of accidents and injuries, especially when driving or operating machinery. Studies show marijuana use raises the chance of car accidents, even among experienced users who think they can handle it. The combination of slowed reaction time and poor coordination is dangerous, making quick decisions or movements much harder. Even occasional use can temporarily disable key body and mind functions, affecting school, work, and daily life. These risks are real, not just theoretical, and can impact anyone regardless of age or experience. Short-term effects should not be underestimated, as they can have serious consequences for health, safety, and well-being. Long-term marijuana smoking can damage the lungs, causing chronic cough and higher infection risk. Over time, it may contribute to COPD and harm heart health. Chronic use stresses the heart and may increase the risk of heart attack or stroke. For teens, heavy use can lower IQ and impair brain development. It's linked to anxiety, depression, and can trigger mental illness in vulnerable individuals. Cannabis use disorder can develop, making it hard to quit despite negative consequences. Chronic use carries serious, lasting health risks. Marijuana's effects are complex, neither all good nor all bad. It can offer relief and relaxation, but also brings real health risks, especially when smoked regularly. Short-term, it impairs memory, judgment, and coordination. Long-term, it can damage lungs, stress the heart, and harm developing brains. The science is still evolving, but caution is essential, especially for young people. Informed choices require understanding both benefits and risks. As laws and attitudes change, let's keep the conversation grounded in science. Protecting your health starts with knowing the facts.